The risk of becoming a necessary cardiac patient. We know that about 80% of all heart attacks could have been prevented if people really used our basic instructions how to use your human body, a body that will run for 90, 100 years. And unfortunately there are people that don't do that, and what we want to do is to see which are the people that actually went onto the wrong bus line, so to say, which has a shorter trip, and try to convince them that they should change course. You can do it on different levels. I think the main thing we can do is working on population levels, on creating a society that is friendly to your heart. What we can do, of course, in my profession as a doctor, we can try to find patients or people that are already on their way in to become a cardiac patient, and try to detect them as early as possible and help them, assist in changing this course, because we know you can still change the course. It's never too late. What we do in the risk assessment, and that's the session tomorrow, is try to see what tools do we have to find these people that are really at risk, and when we find them, what methods do we have to help them to get out of this little bit sad future. I think it implies all doctors in a way, and I think mainly it affects the general practitioners, because once they come to the cardiologist, they are already a cardiac patient, and you can say they are at the end of the line. And I would like to meet these people much earlier, and that is in medicine it's a general practitioner or the occupational physician, people like that. What I know, and that's from my experience in working with cardiac patients after myocardial infarction, where I've seen how changing the lifestyle, how that actually can affect the development of your arteriosclerosis. It's an amazing experience. From that knowledge, I feel that the main message I want to get across to my general practitioner and to the patient is: take your own lifestyle in your own hands. You have to do it yourself. As a doctor, I can help you, but you must do it yourself. Sometimes, in a bit of a playful way, I compare this with a football field, and I tell patients after a heart attack, look here, you've got the yellow card, but you are still on the pitch, you can still play, but the next time you get a yellow card, it's a red card, you're off. In other words, you've got a warning, you have to use the warning, and the warning says, don't smoke, move around sufficiently, eat adequately, don't become like a rabbit or whatever, but eat good food, and see to it you get enough sleep. If you do these basic things, it's not more complicated than that. You've taken a responsibility for your own lifestyle. And as a doctor, of course, I can help to bring your blood pressure down, I can help to bring your blood lipids down, but you are the one in charge. It's almost useless for me to help you with drugs if you don't take responsibility yourself. The way we sell our message to patients is negative. We tell you may not smoke, you should train, and you eat all kind of funny things. It's wrong. I think we should change this message into something very attractive. It's lovely to breathe fresh air, and there are kinds of physical activities that's just plain fun, and there's so much real good food out there, so why don't change it? And actually, what I feel the main problem for us is a lack of knowledge among our patients. Patients tend to believe that they have no hold on their own health. It's we doctors that have to take responsibility with our pills. And this lack of knowledge that they must do it, they can do it themselves, is a major problem. And we're addressing that in our prevention guidelines also. And in Sweden we have a special working party among cardiologists working on giving patients the right guidance on lifestyle. This has become so much more important over the past years. No, there's definitely no difference there, because people living different climate conditions, they have found their own ways to move around. So in Sweden, moving around in the forest on skis or picking mushrooms or whatever you do, there are always attractive ways to be physically active. But what I want to get across is that you don't have to go to a gym to be 100 years. Just incorporate regular physical activity in your minute-to-minute lifestyle.